I'm Ben Gonzalez, and this is TDI. Well, today we're going to talk about telemedicine. If you have health insurance, there's probably a good chance that your plan offers some kind of options for virtual visits. But what are those visits like for patients? So today we invited the executive director of the Texas Board of Nursing, Catherine Thomas, to help us out a little bit. Hello, Catherine.
Hi, how are you, Ben?
Doing well, thank you. So, start off by telling us what is telemedicine and what is not telemedicine, maybe.
Well, telemedicine refers to practicing patient care
Hmm.
by a digital platform of some kind. It's the same as a provider physically together with a patient, but it's done digitally. So this is generally a video visit that happens via computer or tablet or cell
Hmm.
phone. And your typical telemedicine visit centers around gathering symptoms and other information that leads to a diagnosis and treatment, just like a physical visit does. So, how does it work? With telemedicine, patients can schedule an appointment with their regular provider, or they can schedule it through their insurance plan that might offer a service that connects patients with a provider of their choice. And then in Medicare, they put patient-facing telemedicine into three categories. They call them e-visits, and those are communications through an online portal without a face-to-face interaction.
Hmm.
Telehealth visits are those that are generally done on a video platform like this one.
Right.
And virtual check-ins are when a patient and provider talk really briefly, generally by phone, just to touch bases, maybe for follow-up. Patients have to prepare for a telemedicine visit just like they would a regular visit, and maybe more so because it's a little more intimidating, different for them perhaps. So they have to write down everything that they want the provider to know. That's going to keep you from forgetting things. You want to know all your medications, and those are complicated sometimes because their names are strange. So write those all down or even bring the bottles so that you can refer to them. You want to make a list of your health history and any past surgeries or medical problems you've had so the provider has that information. And then occasionally there will be a physical exam part of the telemedicine visit. And when that happens, if you want to show the provider something like a rash on your arm, make sure that your arm is accessible and you can show that to the APRN in the visit. And I think lastly, you want to get a callback number because the visit, after it starts, you might become disconnected, you might lose your audio-visual, connection, and so you wanna shift to the phone call so that you can find out what to do next, should you call back or should you reconnect.
Right.
So, I'd say in general, telemedicine provides convenience, and it can improve access to care, especially for patients who can't travel, or maybe they have specialty care needs that aren't available in their area.
Yeah, we've been hearing about telemedicine for many years, but it seems like the current pandemic situation has exposed more people to it and given them this option at this time. Does it pose any kind of challenge for nurses and other clinical staff?
I wouldn't necessarily characterize them as difficulties or challenges, but nurses or other staff have to gather some information, usually
Hmm.
for the provider. So they might ask the patient to complete a health history online so that they can put that in front of the provider before the visit. They might want them to get a particular lab test ahead of time, and so they'll send them to the lab for that. I would say nurses and clinic staff generally answer lots of questions, and they can help with the referrals and maybe the follow up with the patients. But
Right.
it's important to remember that when an APRN is conducting the visit, they're going to rely on the information that's provided to them. So preparing ahead, as I suggested earlier, is a really good idea. And lastly, I'd just say that sometimes a nurse is a presenter, and in the role of a telepresenter, they want to facilitate the communication between the patient and the provider. So sometimes they're at the distant site with the patient, the provider is somewhere else, and they're helping the provider assess the patient, perhaps using technology or just visually seeing an area, something like that.
Are there certain kind of symptoms or scenarios where telemedicine kind of works very well?
There are. I think it's really important when you conduct a telehealth visit that you remember it really should be the same quality as a physical visit.
Okay.
So, in other words, a provider should be able to assess and treat the patient just like they would at a face to face visit. That means that the standard of care, what we would expect as a regulatory board, for example, doesn't change for a telemedicine visit.
Hmm.
So, it's generally very good for things like maybe school healthcare, where a student has an issue at the school and the nurse contacts a provider to evaluate the patient and help them decide what to do next. It might be really good for mental health therapy because that generally doesn't require you to be face to face, but on a video platform, you can still see each other and interact in a therapeutic way. And then a lot of minor illnesses like stomach upsets or respiratory infections that are, involving the nose and throat,
Hmm.
rashes, things like that can be easily evaluated in a telemedicine visit. Sometimes it's used for medication management. We're having a problem with this medication. What should we do?
Right. The check-in kind of things.
Exactly. And then sometimes follow up care after hospitalization. It's a good way to connect with the provider, say, how are things going? What's working? What's not? What questions does the patient have? And then sometimes it's used for like non-emergent type care for residents in long-term care facilities. That's not an exhaustive list. That's just some examples.
That's longer than I was thinking. But on the other hand, are there some conditions or symptoms where you might want to skip telehealth and just go ahead and book an in-person visit?
Yes, in those cases where it's difficult to assess the patient without really seeing them physically, that's not an appropriate telemedicine visit. For example, if a person's having abdominal pain, it's
Hmm.
very difficult to assess that virtually.
Right.
It requires the provider to touch, to palpate, to see if there's tenderness, to see if there's any masses, those kinds of things. So it's also not appropriate for serious or life-threatening conditions. If you're having like problems with seizures, chest pain, head injury, breathing problems, those are not really appropriate for a telehealth visit. And
And
then
that's when you'd want to call 911 or get to an emergency room.
exactly. There may be other situations like just you need equipment, for example, and it's not
Hmm.
available. Maybe a stethoscope, an otoscope to look in the ear or whatever. A physical visit might be better in those circumstances.
And but maybe a call to a nurse line or something like that will help you decide what kind of a visit you need. I was going to ask you about that. Besides a video conference like we're doing, what are some other things that might help give people options to visiting a primary care clinic?
Well, if you have a primary care provider, it's generally a good idea to call there first and to see if this particular problem lends itself to a televisit with a provider, either a nurse practitioner or a physician. Um, they generally are used to screening those problems. The nurses in these
Hmm.
primary care clinics know what should be done. There are alternatives, though. You can walk into an urgent care clinic or what's called a walk in clinic. That may be a good option. If they can't evaluate you there, they may refer you on. And but if a telemedicine visit is available, you need to be screened first to see if it's appropriate. So it's always good to call first, maybe see if this is a good situation for a visit by telemedicine.
Very good. Thank you, Catherine. Well, I really appreciate you talking to us today. Well, as we often say, if you have questions about what your insurance covers, start by calling your health plan. You can check the ID card for a number, or you can visit the plan's website and see what they offer regarding telemedicine or virtual appointments. And if you have other insurance questions, check our website. It's tdi.texas.gov, or you can also call our helpline. That's 1 800 252 3439. For Catherine Thomas, I'm Ben Gonzalez. This is TDI.